A virus that has taken as many as 22 children's lives in India so far. A deadly virus that has been circulating and is causing more and more chaos by the day. Welcome back to the latest update series of Drishti IAS. This is Divya Kawatra, and today we are going to discuss about the very saddening, very threatening Chandipura virus. What the virus is, how is it spreading, how do we protect our children from that? Let's understand all of that. It is very necessary for your awareness, for the awareness of your parents, for the children around you. Please listen to this carefully and spread awareness regarding this to everybody else. All right? Okay. Let's talk about this virus. It has taken 22 children's lives already in Chandipura virus, that is in Gujarat, that we've seen in the monsoon season. 35 cases have already tested positive. 184 are still suspected. That is what the health ministry is telling us is the current data. All right. Let's understand what is happening. What are the key takeaways here? All the affected patients are children under 15 years of age. This can tell us that mostly the virus is affecting children and not the adults. Number one. And secondly, geographic spread. The cases are distributed across multiple districts. It is not concentrated, right? It has spread to multiple districts. That means it is spreading somehow, including Gandhinagar, Sabarkantha, Patan, Rajkot, Bhavnagar, etc., rather than being concentrated. What are the emergency measures? Gujarat Healthcare Authorities instructed both government and private pediatric facilities immediately to admit the patient showing any sort of symptoms, don't take any risk, and directly get them to ICU beds with oxygen ventilator support so that the rapid organ failure that is happening under this virus can be prevented. What is happening? Within seconds, the child starts to, tremble, and suddenly all the organs start failing one by one. And before you can even put down the ventilator machine or take the patient to the ventilator, everything is done away. That is how quick it is affecting, and that's why directly they are being admitted into a ventilator slot so that instantly a ventilator can be adopted or added to their treatment so that the organ failure can be stopped. That is how serious this is. And at that same time, vector control is there. Health teams are spraying insecticides, dusting powders around the rural residential areas also, animal husbandry structures also, so that they can control the sandfly populations, right? These sandflies that are creating this chaos, their population can be controlled by spraying insecticides so that this can be stopped, right? We are trying to do that, but beyond that, we need to do a lot more. But before that, let's understand a little bit about the virus. First of all, why the name? The Chandipura virus is named after the Chandipura village that is located in the Nagpur district of Maharashtra. Okay. Why so? In 1965, for the first time, an outbreak of acute illness occurred in Chandipura village. First isolation scientists from the Virus Research Center in Pune, that is now ICMR, collected the serum samples from patients in the village and isolated them previously because it was an unknown virus, right? The standard naming convention came in virology. It is a standard practice to name the identified pathogens after geographic location. So because of that, they were called, it was called Chandipura virus, all right? What the virus is, it belongs to the vesicular virus, okay, because belongs to the category of vesicular virus. First isolated in 1965 in Chandipura village. Acute encephalitis syndrome. What does it cause? Acute encephalitis syndrome leading to severe brain inflammation. Severe brain inflammation happens, and through that inflammation, all the organs start flailing, right? This is a vector transmission. The primary vector here, it is transmitted by infected female phlebotomine sandflies. Phlebotomine sandflies. It is spreading because of the sandflies. What are the sandflies? If you can look at the image, the background of this is the sandfly that is ultimately causing this virus. All right. And the non-contagious, the virus is not spread directly from human to human. It is like not contagious at all. Like via physical contact, coughing, or respiratory droplets, right? It is not spread according to that. Clinical progression, however, infection is notorious for extremely sudden onset and rapid progression, escalating within 24 to 48 hours, everything is finished. It doesn't even take more than that, right? Yeah. Initial signs, what are the initial signs? Sudden high fever, very severe headache, intense vomiting, muscle weakness, and diarrhea. But you see, these symptoms are so common that you would mistake it for anything else. That is what is causing the problem, that you can mistake them for anything else because they are very common features. It is not something of an extraordinary structure, right? But still we have to be very cautious. Neurological phase also comes. After this comes the neurological phase when the virus has deepened, that you have seizures or convulsions, altered sensorium, severe lethargy, confusion, photophobia, disorientation. These are the symptoms that come on later on once the neuron facilities are affected. Okay. What is the critical phase? Rapid onset of encephalitis. What is encephalitis? The brain starts to swell. It stops giving any signal to the body, and because body is not getting any signal from the brain, it stops functioning. That is organ failure, right? That is when the organ failure occurs, and suddenly the patient goes into respiratory disease or coma or such a horrible structure, right? Lastly, about the treatment and prevention, if we talk about no antiviral or vaccine, there is currently no approved antiviral drug or prophylactic vaccine specifically targeting this. Supportive medical care is there. Early hospitalization is critical. If you bring them to the hospital at an early stage, it can still be controlled, right? Other than that, we don't have any medication. Treatment focuses on managing the brain swelling. You don't have anything to attack the virus exactly, but you can control the brain swelling up until the virus exits the system, right? Until then, if you control the brain swelling, that will not lead to organ failure, and controlling, it will also help control the seizures and anticonvulsants, providing fluid support, maintaining ventilation, etc. Right? Yeah. Preventive measures: protecting children from insect bites, use repellent and bed nets, eliminate stagnant water or debris near homes, dusting animal sheds with insecticide as the primary ways to interrupt transmission. These are the ways you can prevent it firsthand, like keep your children safe. That is the method to do that. Okay, please do that. Please follow it for everybody, and it is not something that is only constrained in Gujarat. As you know, it was found first in Maharashtra, right? It can spread out, so everybody should be aware of it. And in the monsoon season, especially the insects and the flies and everything, the dust and everything, it captures a lot of it, and we should be extra careful if children are going out to play or anything. Please pay attention to this. Please spread awareness regarding this so we can save our children from getting affected by this. All right. Yeah. On that note, we have an information for you. ISGS Foundation course is getting launched from Noida Center in both in English medium. That is starting from 24th of August, where you will get structured classes, modules, subject-wise printed notes, books for prelims as well as mains, evaluation of 500 mains questions, and then the best part, for 3 years you get prelims test series, current affairs classes, and current affairs magazine, all under one GS Foundation course that you can join. The date, 24th August. And how do you join that? You go to the Drishti IAS website or the Drishti IAS learning app, or you can give us a call on 87501 87501. All right. That is how you join this. And on that note, we have a question for you. We have a question for you regarding the Chandipura virus, the deadly Chandipura virus that is affecting our children. Read the question. Give us your answer in the comment section. Give us your answer in the comment section. And on that note, we have another question. Tell us the name of some other vector-borne diseases that have recently been seen or taken away the lives of people. What are the other vector-borne diseases in the history of India that we have seen? Give some examples of them in the comment section that you know about them, all right? Yeah, that was our question. Okay, give us your answer in the comment section, and that's about it. That's about Chandipura virus, the deadly Chandipura virus. Let's hope for the safety of everybody, and let's spread awareness so that everybody is safe as well, right? Okay, that's about it. Thank you so much for joining. See you in the next video. Till then, take care. Thank you. Bye-bye.
For more informative content, like, share and subscribe, and do not forget to press the bell icon to get the notifications.